And now I would like to call Mahipal sir, and is talking about role of the femtolaser and the cataract surgery. Over
Thank,
to you, sir.
thank you very much. Thank you, Rajiv, for always having me in your course. Uh, I'm supposed to be talking about how to get clear vision. I'm not talking about basics of femto or anything, but how to get clearer vision with the use of femto laser. So this is a famous saying which says life can only be understood backwards, but unfortunately it has to be lived forward. So in retrospect, you can say that this is what should have been done or this is what it is, but ultimately as of now, you are looking at what future things are holding for us. So for clear vision, as has been impressed by my previous speakers, the astigmatism management is something that is gaining ground significantly. And this is a market scope study of the year 2019, which says that only 33% of patients with significant astigmatism are getting their astigmatism corrected, and 49% did not even have anything done, and the rest are the LRI, the LASIK, etc., and the femtosecond laser that is being done. So when you're looking at the femtosecond laser, the femtosecond people, obviously there is a slight contradiction in terms, because they are also manufacturers of IOLs at times and they want to sell more of toric IOLs. So they have not concentrated much on astigmatism correction in the LRIs that is there. So, however, the catalyst system has moved. That's a system I use, so I'll be talking about it. They have moved on to the catalyst. So, COS is the catalyst operating system 6.0 version, and now also 7.0 version, which we'll be talking about. So, the 6.0 version gives you simplified astigmatism management workflow. It increases the operational efficiency because you don't have to feed in much. It's an automated system with artificial intelligence, which is going to give you where the LRIs, etc., have to be placed, and it gives superior results which are there. So there is a direct entry of the pre-operative data. That means whatever is the pre-operative data, that can be entered directly. There is a built-in nomogram. So you had the Donald feed, and now you will also have the Stevens nomogram. You had nomogram for penetrating penetrating LRIs, and now you will have for intrastromal. That means that they are not full penetrating. So that is going to be a built-in nomogram, and there is also radial laser alignment marks. So even post-operatively, you can see whether your toric lens is in position or not. So there are two lines that come on the axis where the lens has to be placed as the toric alignment marks. So this is just to show you. This is it will tell you as you feed in here. This is the axis that is fed in here. You have the optical zone at which you want to do 8 millimeters, 7 millimeters, etc., and length. So this is automated, and these are the two LRIs, which is 17 degrees is the length of the LRI at 8 millimeters, and this has to be matched with cyclotorsion compensation. That is very important for LRIs, that cyclotortion compensation has to happen. So this was linked with a kind of a pentacam which is called as Cassini, and we impressed upon that you have linked it with Cassini, but most of us do not have a Cassini. That's the name of an equipment. So how do you work and how do we kind of get it? So this was more like a little manual thing. But when you, for those in the studies who had the Cassini, when you looked at the sample size, the refraction, etc., the alignment marking, as also you looked at the IOL alignment error, you could see that there was very little error. So that means this was found to be much better than manual markings that you have for making LRI or for the placement of the toric lens. So this was automated and it gave you a good outcome that is there. So this is, you can see the laser alignment marks. So this is the line that I'm talking about that you get on the cornea. And this is the Technis toric family of IOLs which one is looking at. So the hitting the target and it remaining grip with this thing is that, I don't know, for those who know, there is the Technis 2 variety that has come, which does not have a smooth glistening free edge, but it is serrated. So the haptics are more sticky, and that's all that they have done. So therefore rotation goes down. This is the COS 7 system, which is just we'll be starting work on this as soon as I go back from the conference. So this is a limited market release, and then will become a market release. In this particular thing, it is being linked now with the IOL Master 700, which all of us have. So from a Cassini, it is being changed to the IOL Master 700. Like you have the Callisto system in the microscope that is linked with the IOL Master 700. This is going to be, and the calorimetry data will automatically populate arcuate incisions and toric mark calculation. So this is something which is important. This is what you are going to get. And iris registration aligns the patient's steep axis. So whatever is the steep axis that you get on the IOL Master, that is going to go to the catalyst system, and that is going to align. And as I told you, the Donald field is there, the Stevens nomogram, they will automatically calculate the arcuate incisions where you want, and adaptable incision preferences with surgical customization options for total keratometry. The other thing is that the LRI can be based on either the total keratometry or the anterior keratometry. Right, some surgeons are believing that it's the total keratometry based on which you should do the astigmatic correction, so it can be done on both. And how you want to write the toricity for the LRI, whether with the rule, against the rule, or oblique, will be there, and optical zone preferences will be there. Toric alignment calculator customized to surgeons, so it can again be on total keratometry and also include the surgically induced astigmatism. Automatic cyclotorsion compensation will be there. Now, the other thing that is coming in to get clearer vision is to do a repeat laser, to do a primary posterior capsulorhexis, which is there, so you can have a clear vision even subsequently. And the same thing LSCS for pediatric population, where you need to do a posterior capsulorhexis in majority of them. This machine will allow you without having to buy another laser LOI for these particular cases. So this again is going to help you in clearer vision. The other thing that is being worked upon is called as LYRIC, that is laser induced refractive index change. And this laser induced refractive index change without making perforations can be either on the cornea or on future intraocular lenses that are being manufactured. Like you have the light ablatable lens. Similarly, the femtosecond laser can be used on intraocular lenses that have been implanted, and if you have power, so you can use a femtosecond laser to change the refractive index or the curvature or the astigmatism on those lenses. So this is the future that one is looking at. And there is another thing, which is the artificial intelligence, which is, I think Rajiv has this. This is the Lens AR system with Streamline 4, which gives you an integrated swing through camera, this thing, imaging, which identifies the nuclear density as to what is the nucleus density of a cataract, and basis that it will say what cuts, how deep, how many energy, etc. that has to be done with the laser. So it is an artificial intelligence that is working, and this is what it is. It can give you the patterns. See, this is category 1, 2, 3, 4. That you can see as you keep on going into harder cataracts, it's going to customize the nucleotomy, the techniques that has to be done, and this will enable the surgeon to make also microcorneal incisions on the cornea in pseudophakic patients, traditionally independent of the arcuate incision. So you can see that these are laser incisions that you can do. It also makes at present in the capsulotomy the incisions, so that the toric alignment can be kept. So there are two ways by which you can see toric alignments, intraoperatively and postoperatively, that you can have a capsular knuckle and which is at the axis at which, or you can have alignment marks on the cornea which are going to stray, which are intrastromal. So summarizing the horizon, I think in the femtolaser there is room for improvement in logistics, smaller, more mobile services. Primary posterior capsulorhexis will be coming. Future laser technologies will allow refractive enhancement and treatment of the implanted intraocular lens even after it has been implanted, to enable target correction to get clear vision in vast majority of cases, and LYRIC on the cornea via compaction of collagen fibrils. So it is not cutting, it is compaction of collagen fibers, can be done without refractive surgery. And maybe tomorrow presbyopic correction by inducing spherical abrasions on the cornea could be on the horizon. So friends, this is something on the femtolaser which is there on the horizon to give you clearer vision. Thank you very much for your kind attention. Thank you.
Thank you, Dr. Mahipal, for the nice presentation on the upcoming things in the